Well, good morning, PCOH. How's everyone today? Oh, that was a lukewarm. Well, good morning. Well, happy Veterans Day to all of the veterans. I know there must be some veterans in the audience here. Any veterans here? Raise your hand. Great. Well, I'm so excited to be here. I was so glad to be asked to be here at this conference. I know that when the request came in to me, I had a flag that said, oh, this is Veterans Day, and Department of Health is closed and, no one's working. And I said, PCOH, I'm going to be there. So thank you so much for inviting me here. Okay. Well, I'm just going to give a little bit of an overview of oral health in PA, and I think that many of you are aware of these statistics, but just going to highlight some of the issues, talk about access to oral health care, and then touch on community water fluoridation, and then our oral health plan for Pennsylvania. So you all are very familiar with this, and I think, don't need to preach to the choir that, that oral health affects us in so many ways. And so it's not just cavities that we worry about, but we worry about other diseases and other morbidities and limitations that can be caused by poor oral health. So including endocarditis, heart disease, issues in pregnancy, including prematurity and stillbirth, miscarriages, and also pneumonia. So oral health is not a trivial issue for us as a state, as a Commonwealth, but as a nation as well. So a lot of the tireless work that you all have been doing have contributed to the successes that we've had here in Pennsylvania. So you can see in terms of dental visits in the past year, Pennsylvania ranks 14th as a state, but still that's less than 70% of people who have that access. So even though we're doing better than the nation as a whole, we still have a ways to go. But we are doing better as a nation of a whole because of the hard work that you all are doing. Dental visits in the past year, we know that that average number does not relate to everyone and every population. We see that those that have lower income, less than $25,000 a year, don't have those same rates. We also see that those that have achieved a lower level of education also don't have those rates. And so that we have to focus not on our overall statewide number, but making sure that we're getting equity in terms of that access as well. We also have seen not only related to education and income, but also in terms of racial disparities. We still have that in terms of access to dental care. So again, I know all of you know this, but the number one reason that people don't seek dental care is because of the costs. Many people don't have access to dental insurance and don't have a way to pay for that. Also, many people still have a fear of dentists and not wanting to go for that reason, but also dental care seems to take a back seat in people's mind in terms of what is needed. If someone does not have a toothache that is causing severe pain, then they're unlikely to think of dental care as a priority, especially those with low income or having difficult access won't prioritize that need for dental care. So looking at children and preventative visits, we know that, again, ranking 14 in the nation out of states, and again, in large part to the tireless efforts that you all have had. We are above the average in the United States, but again, that is not spread out equally across this Commonwealth. Again, we are overall doing as well or better than the national average in these different areas in terms of race. But again, we are, it's not equal, right? And so that we do have lower rates based on race and ethnicity, even though as a Commonwealth we're doing better than the nation. Again, education, that is one of the factors that seem to have much lower access in terms of dental care. So I'll talk a little bit, switch gears and talk a little bit about access. So many of you are involved in initiatives to make sure that we have equity across the Commonwealth, because we know that there are very many areas that the citizens don't have good access to dental care. And it's estimated that in the Commonwealth alone, we've got 149 areas that are designated of shortage of dental professionals. And so that covers almost 2 million people who don't have ready access to dental care. This just shows the dental professionals that we have within the state, but realizing that even though we have this many dental professionals, they're not equally distributed. And so that, again, 149 areas where they don't have this access, a lot of the access is concentrated in cities and other urban areas, but there are very many areas where people don't have access to good dental care. Switching gears again a little bit to community water fluoridation. Again, preaching to the choir, you all are strong advocates for community water fluoridation. You know the benefits and the needs throughout the Commonwealth and the nation. So in March 2019, it was estimated that 64% of Pennsylvanians have access to community water fluoridation at an optimal level. And in the nation, we are lagging because that's about 73%. We know that we have had an ongoing battle with municipalities stopping fluoridation or not starting fluoridation. And so a lot of the work that you all have been doing have been as advocates. As Helena mentioned, I was very intimately involved in community water fluoridation in Meadville, and I think I was very naive as a healthcare provider. When I found out that we didn't have community water fluoridation, I thought, well, we'll just go ask and then they'll just put it in. And boy, was I wrong about that. Oh my goodness. I think, thank you, PCOH, because you did a lot of hand-holding, listening to venting, but advocating, even coming on the ground for us to help us get over that mark. It took an unbelievable number of meetings, a lot of community collaboration, and over 4 years of work to be able to get community water fluoridation. But you know, we thought it a small process because 40 years earlier, that effort was undertaken and wasn't successful. So that success was due in large part from all of the support that PCOH provided. So again, you know, just support in terms of just advice, resources, advocacy, just anything that you can think of. So really appreciate that, and I know that you're doing that for many other communities as well, but very, very appreciated. So I'm just going to touch on finally our oral health plan. So the Department of Health does an oral health plan, and this is the plan for 2020 through 2030. And so there are 3 primary areas that we're focusing on: improving access to dental care and preventative services, but also for health literacy. The second one is increasing the workforce, and the third is infrastructure. So As we look at each of these priority areas, we also want to make sure that we're looking at the full scope of what's needed to achieve success in these domains. One of the real important focuses for us is health equity. We want to make sure that realizing that the services are not spread out equally throughout the state, and that there are areas where there's difficulty in access and difficulty in terms of just reaching people, making sure that they have access. We want to make sure that we use that equity lens in the work that we're doing going forward. So the first priority area, access, prevention, and education. We want to make sure that we are addressing health literacy. Sometimes we make assumptions about what people understand, and we don't often elicit enough feedback to make sure that the messages that we're putting forward are being well received. And then we want to decrease those disparities. Again, you guys have done a lot of great work, and so, put us ahead of many other states. But that success is not equally realized. So there are communities and there are populations that need to make sure that they are granted access as well. And then really working to make sure that we get services, especially in those areas of shortage, really reaching into, sometimes they're urban areas, sometimes they're rural areas that really don't have the access. And then community water fluoridation is really a great equity effort, because people don't have to take any extra effort to be able to get it, and you can make sure that you're getting that benefit across society. So continuing to work on that. So the other one is the oral health workforce. And so that we know that we have a shortage of oral health providers in general. We know that the ones that we have are not optimally dispersed. And we know also that sometimes it is difficult for people to access services, and they are sometimes reluctant to access services if they really don't feel that they have a connection to the provider. And so we do need to diversify the workforce and make sure that we have a source of new people coming in and working on developing them to provide that workforce going forward. And then, again, infrastructure improvement. I think that with this pandemic, it's something that we really have seen that we've not put a lot of resources into maintaining our infrastructure. There's infrastructure that we have that are physical structures. There is a lot of technology and communication that we're really behind on. And so this is an opportunity to focus on those gaps that have been identified, and make sure that that is stronger, and so that we build an infrastructure that will help us to do the work that we need to do going forward. And so we need all of you, and we need all of our stakeholders. This is something that can't be done. We certainly can't do it from the Department of Health alone. We can't do it by government alone. We need our providers, we need our insurers, we need our community grassroots organizations and other stakeholders to be together on this effort. And that's what you all do here as a coalition. Put your ideas and resources together to make sure that we're getting those outcomes that we desire. And that's the type of work that we need to continue. I just want to touch briefly on the loan repayment program, and I think that many of you are already aware of this, but just want to make sure that everyone knows for providers, there is a loan repayment program that can help us to attract providers, especially to those shortage areas that we noted before. And so those dental providers physicians or dentists can get up to $100,000 of educational loan repayment over a 2-year period if they're working full-time. If they're working part-time, can get $50,000. And then other providers, including dental hygienists, can get up to $60,000 for 2 years, or working full-time, or $30,000 for part-time. So we'll continue our efforts to, again, recruit and diversify the workforce, and continue to lift up the oral health of Pennsylvanians. And so the Department of Health is here. We're your partner, and so we want to help in any way that we can, but we also want to thank you and appreciate all of the hard work that you're doing, and all of the successes that we are realizing is in large part to all of the work that you are doing. So thank you very much, and thank you for letting me join you here today, and again, happy Veterans Day.